Welcome to The Empowerment Show, a podcast designed to empower women like you to take control of your lives, make informed decisions, and redefine success on your own terms, beyond the noise of influencer culture.
Okay. Hello, everybody, and welcome back. Today we have a very good friend with us. This is one of my personal very good friends, Nancy Robles. Nancy is MSN NPC. She is an advanced practice provider at a major healthcare center here in the Bay Area, one of the premier cardiac centers in California. She specializes in inherited cardiovascular disease, advanced heart failure, and sports cardiology. Today, we really want to talk about GLP-1s. And this is something that we have so many questions about, but knowing that effective weight management is a vital part of, reducing cardiovascular risk, Nancy helps her patients kind of go through that journey with a combination of lifestyle interventions, GLP-1s, and you are beyond your clinical work. You are also an independent consultant for the American Heart Association and other major industry leaders, bringing valuable expertise and insights to the field. She is also the person who, if you have a family member who is, or you are waiting for a heart transplant, she is the one who is going to be handling your care and making sure that you are in the best shape possible and the best health possible that you would be able to take that transplant and keep it successfully. So really amazing work. So thrilled that you are here with us today. Love to hear a little bit about your job, what you do, and then about GLP-1s. And one of the reasons why you're here that I thought was so interesting is you told me one of the things that you are prescribing the most is GLP-1s for your patients as they are on their health journey. So thank you for joining us.
Thank you. I'm so happy and excited to be here with you ladies. Thanks for the introduction. It was lovely. So you may ask yourself, why is the cardiology nurse prescribing GLP-1s? So GLP-1s have been around for a while. They were first used for diabetes and clinical trials were being done. I work with an FH, familial hypercholesterolemia specialist, basically someone who specializes in patients that have high levels of cholesterol that are resistant to medications because it's a genetic condition. So they do a lot of prevention. And so I knew about GLP-1s a long time ago. Now, how did I get involved in it? Well, American Heart Association 2023 conference, their biggest conference for cardiology, the late breaking news science was about GLP-1s and cardiovascular disease. The trial included about 17,000 patients over 51 countries or 41 countries, one of the two, and 8,000 of them. So it's a double-blind placebo study. About 8,000 patients had cardiovascular disease, but without diabetes. And they had a BMI of 27 or greater.
Okay.
And so that qualified
as obese.
That's overweight.
That's overweight.
Very good question.
Got it.
And so if your BMI is 27, you're overweight, but you could use it off label for,
and then body mass index.
Yes.
So your height and weight together,
proportion,
gender and age and everything.
So greater than 30 is obesity. So this study found that in those 8,000 patients that had cardiovascular disease, no diabetes, and their risk for complications decreased by 20%.
Whoa.
So this was the study that put it on the map for cardiology. I mean, we already knew there was great benefits from weight loss. More than half of people in America are overweight, and, obesity leads to diabetes, and, number one killer of women is heart disease. So it's just, you can't have, if more than half of, if close to half of people have obesity, you can't really cure diseases and conditions without managing the obesity first. So once the SELECT trial came out, a few months later, FDA approves it for cardiovascular risk reduction, basically reducing your risk for heart attack or stroke if you have cardiovascular disease and you're overweight. You don't necessarily have to have diabetes. So we began prescribing it. And initially there was a shortage, or patients couldn't get it. And then there was no shortage anymore and people are getting it. And then we had challenges with health plans not covering it and us having to, advocate for patients and provide more clinical data. And now it's gotten easier. It's gotten a lot easier.
So health plans are kind of feeling like this is something they should, because it feels like if it does cut down all these comorbidities, it would make sense for health plans to want to cover these things.
Yep. So this year, I believe semaglutide was approved for patients that have diabetes and kidney disease. So now you can say, patient has diabetes, kidney disease, they're not overweight, but it helps prevent, the risk for kidney disease.
Oh, so even if they're not overweight, there are still benefits.
To prevent your kidney disease from getting worse.
Okay, so if you have limited kidney function, because once your kidney stops functioning at a certain, you can't ever get that back. Like it doesn't regenerate.
Right, because it didn't
for my mom.
for you. Yeah.
Right.
Yeah.
Tirzepatide was approved just earlier this year for obstructive sleep apnea in severe obesity, severely obese people. Yeah. So even if you don't have diabetes or maybe a heart condition, but you have severe sleep apnea and you're very overweight, they're approving. Well,
Why?
FDA is approving it for that.
Why sleep apnea?
Obstructive sleep apnea can be very, very damaging for the rest of your body and your heart. It puts a lot of stress on your heart.
Yeah.
And so because of that stress, your heart, one of the chambers in your heart becomes enlarged.
Yeah.
And that can lead to atrial fibrillation, which can lead to stroke. Okay. So it's it has pain and complications. Yeah.
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 So these drugs are they are actually solving at the root some of these problems.
Yeah.
Okay.
Yeah.
I feel like, these drugs are very controversial. There's a lot of people in social media and celebrity culture who are taking them to lose weight when they don't necessarily need to lose weight or have any of the comorbidities that you just described. And so we have that.
But I just want to say, I don't know that we can say that with a blanket statement.
True.
Because
Very true. We fact check you.
We don't know that they don't have diabetes or kidney disorder or obstructive sleep apnea or a family history thereof.
Yeah. So maybe the perception is that there's a lot of people in Hollywood or just influencer culture who are taking these drugs and they don't necessarily need to. What do you say about that aspect of society where it's created this craze on social media and people are even taking Ozempic now because they want the same effects? Have you heard about these? There's other drugs that
these are compound, right? These are compounded.
They're not FDA approved, but then there's compound companies.
They're compound.
Yeah. Anyway, so I'm just curious for your thoughts on that.
Yeah, great. So they're using it for cosmetic reasons, and it's an off-label indication. And the danger with that, or the concern with that, is that we don't have data. We don't have studies done on underweight or normal weight people, and a lot of our Hollywood stars are almost underweight. So there is no data. So we don't know the long-term effects, but I would be concerned about muscle mass loss. Totally. And just, putting your body through something that's unnecessary if you're not overweight.
Yeah. And the fact that they're taking it and creating this interesting social media debate about it, I think it's damaging for the people who actually do need to take it. And now there's this connotation about it. That's what's really frustrating.
And what's sad about this is that this is because of the expectations and, for example, the Hollywood patriarchy.
Yeah, common theme.
So I would say the main concern is that the root of the problem is that because one of the contraindications to starting these drugs when we prescribe them is history of eating disorders. Or anxiety, depression, because you're at risk for people that use food to relieve their anxiety, and you no longer have that craving and that food because they're not hungry. Their depression will get worse. So you really, there's so many other things.
Because they don't have their coping mechanism that longer helps.
Exactly.
Oh, that's interesting.
So one of the other things that I've heard is that it cuts down on people who have drinking issues or other addictions.
Yes.
That there's been progress for them, or they're seeing improvement in that. Yeah.
So what I tell my patients when we're starting on a GLP-1 and I do the, brief intro educational session, they later do more education. But I first start off with, this medication works in your brain and it works in your gut. In your brain, it reduces cravings, it reduces your hunger, it works in the part of the brain that tells you you're full. And in your stomach, it slows down digestion. So you feel fuller sooner and you feel fuller longer. So I'm sorry, what was the question originally?
About addiction.
About big time. So I think it has something to do with that, the brain, the function on our brain, the cravings. I actually have a real case in one of my patients who was an alcoholic, and we took care of him because just because you're an alcoholic doesn't mean you can't have care or you know, we're going to take care of you. And the reason I started prescribing GLP-1s in my practice also is because access to primary care is very, very hard. Like, it's so hard to see.
I have good employer-based coverage, and getting a primary care appointment is
impossible.
Rigmarole.
You have to go through 10 different phone calls with
and it takes forever.
AI chatbots, and it's just
So initially we would say, hey, tell your diabetes doctor that we recommend this for you, that this would help reduce your risk for, cardiac events. And they would go, first of all, it would take forever to get an appointment with their diabetes doctor, even though they have diabetes, because usually it's the team that's managing. And then diabetes might say, so if a patient has diabetes, by the way, I don't prescribe for them. I let endocrinology take over because it's more complicated because they have diabetes. So I only prescribe for non-diabetics. So just, how difficult it is to navigate the healthcare system. So they would come back to me and they said, no, they say they can't. They say it's not going to be covered. And I'm
luck.
Yeah, no, I'm grateful that I have a support team. Everything I do, I have like 4 people that help make it happen. A patient visit takes a lot of people to make it happen. And so we have learned how to, what to write and prior authorizations, what to say. And, a primary care doctor might submit something, it'll get denied, and they tell the patient it's denied. We know that that's the company's first reaction is to deny. Someone may not even have read. And so we go and we appeal.
Wow. And patients have to go through such bureaucracy just to
patients, very few who have, the drive and the time, they will do it themselves with the insurance company. But most providers don't have the bandwidth to do this.
Yeah.
And I don't give up easy.
Love that.
And I'm challenged by
wonder you two are friends.
So I go in, wait a minute, justice. It's just so hard. So I said, well, let's do it. And thankfully the team said, yeah, let's do it. It's the best for our patients. It's for their benefit. And we have close contact with them because they have a cardiac condition. So we see them every 3 months and we're in contact with them every 3 months or
on the question of addiction, though, do you have patients that have seen a decrease or an improvement?
Sorry, I got off track.
She got excited. For justice.
So this patient had, chronic alcohol use, and we've been talking to him for years. And the first visit we had, so I see them every 4 weeks because you increase the dose. So the dose for diabetes is different than the dose for non-diabetics. And so I meet with them every 4 weeks to make sure they know about diet, exercise, and then we look at side effects and progress.
Yeah.
I remember our first meeting, he said, you know what? My alcohol cravings are almost gone.
Wow.
Yes.
Interesting.
And I thought, wow.
Interesting.
This would be a game changer.
Well, there's a mental thing, but also the stomach issue, right? I mean, depending upon what you like to drink, my daughter and I went to Oktoberfest this year. I'm not a huge beer drinker, but I can tell you, I got to a point in the night where I was like, I can't physically consume any liquid. So,
but didn't we talk earlier about how you're gluten intolerant, my friend?
I mean, there's an issue.
I don't have to do it.
It's an issue.
It's okay. I love it.
It was Oktoberfest. What are you gonna do? I had dirndl. I got the beer. I'm gonna have water at it. No, not
blasphemy. No. Something that is interesting for me about this whole trend. So my husband's from New Zealand, and in other countries beyond the US, pharmaceutical advertising is not a thing. Every other ad you see on TV is for a drug. And now, Ozempic, that's stuck in my head.
Do not take it if you're allergic to Ozempic. Yeah. You would only find out if you took it and then found out you were allergic to Ozempic.
That song will forever live in my mind now, along with others. Wegovy's pretty catchy too. And
you really do have cable.
I know. Oh, wow. We kind of have the news on. We're not the example. I'm just going to put that out there. So anyway, but my husband's always shocked that every other ad he sees is for a drug, and that half of those drug ads are now for these drugs.
Really?
Yes. And so, and it really is off-putting for him. And so he has this kind of bias against them because he's pharma's now just peddling these drugs on people. And that should be a conversation between a patient and their doctor. You shouldn't have a patient going to a doctor and being well, I saw or I heard that.
To be fair, I think all these commercials do tell you to ask your doctor if it's right for you.
And I would say a lot of people wouldn't know about a treatment that's available unless these ads were there.
So are we pro pharma advertising?
Interesting.
I'm pro awareness.
Love it. Okay, that's great.
And if they have the cash to provide the awareness,
Yeah,
yeah.
very fair. But it's just interesting culturally because in other countries,
It doesn't happen.
people don't have that awareness.
Yeah.
Learn about drugs via a conversation with your
Well, we can also talk about how our healthcare system has been overly monetized and commodified. And that is part of the reason why drug companies find such rich pickings with telling patients,
Yep.
ask your doctor, right?
Totally. It's
Yeah.
interesting to hear like from somebody from not from the US.
Yes.
Something that you were talking about earlier too that was interesting to me is so I have a history of I've had like every eating disorder in the book. Didn't eat, ate too much and then would throw it up, was orthorexic where like, I would like count my almonds and I was crazy. Not crazy actually. Okay, that's not okay. I was not in a good place.
Yes. Yeah.
And so I have this bias against these drugs because to me, they seem like a cop out or like an easy way out when I like went through over a decade of like working so hard to be skinny. And how do you juxtapose that or explain it to people like me who are like kind of triggered by this new trend?
Oh, I'm so glad to hear this. I've never heard this perspective yet.
Okay.
So I have been in healthcare for over 20 years. I was an ER nurse for over 12 years. And I
Really great stories. Amazing stories. Just
That
I should write a book before they go away.
they won't go away. They'll scan these days.
Yeah. But most of our patients in the ER were diabetics with their blood sugars out of control, heart attacks, stroke, people with obesity. And in my practice, I have, I deal with patients from all spectrums of life, and even our affluent patients, struggle with obesity.
Yeah.
The issue with obesity is, so people might say, why don't you just diet and exercise? Or patients, when I talk about GLP-1s, they'll tell me, no, I know what to do. I'm going to try it on my own. And I just say to them, how many years have you been trying to lose weight? I know you've done it. I know you've tried. Like, I already know. I know you want to be healthy. And you have barriers that are out of your control is genetics. Okay. Family history. That's out of your control. Can't do anything about it.
Totally.
Another that we have very little power in or almost non-modifiable risk factor is our environment.
Yeah.
What kind of food do we have access to? Do we have access to healthy, organic vegetables, fruit, meat that isn't
non-GMO, non-antibiotic.
You live in Sacramento, you live in New York, like we have access to things that people in food deserts around the US do not.
Well, and then
Well, let me be clear. It's at an extreme premium, though. I mean, I live in Manhattan,
Yeah.
and like,
Don't talk about eggs.
$20 for a head of lettuce. Yeah.
yeah, you can eat healthy if you can afford it, right?
Yeah, which is the issue. Anyway,
So our environment, our environment is almost against us. Exercise. Do I have time to exercise? I really have to plan ahead and say no to a lot of things.
It's
to
hard.
build in exercise.
Yeah.
So, but
No, I want to revisit, like I just said, stress. And I know I had a lot of changes about a year ago, right? I was coming out of a really long-term relationship. I was making major career changes, and I was at a point of just horrible stress. So I wasn't eating right. I still had picked up weight during COVID, drinking too much wine, not making time to exercise, working 70, 80 hours a week. I didn't change any of those things other than I reduced the stress environment, and I dropped probably 20 pounds in like 2-3 months.
Yeah.
And so that's another factor, right? You can do all the things, you could exercise, et cetera. But if your cortisol is off, if your stress hormones are off, you're not going to drop.
Yeah.
stress slows down your GLP-1 hormone. So
So tell us more about like how it works and like, can you naturally increase that?
Or how do you like kick it into high gear?
Yeah, tell us.
So ways to naturally increase your GLP-1 levels is to get good sleep, plenty of sleep. We don't talk about sleep is like food and water, guys.
Okay, strike one.
Okay, sleep is like wine, okay?
I assure you I have way more of one than the other.
So sleep, sleep is one.
How much sleep should we be getting?
Okay, so I've heard really great documentaries on this, and it's really what your body needs. We're all different. Some people need 6 hours, some people need 10.
We're not getting that.
I'm an 8-hour person. So whatever you feel that makes you wake up refreshed, energized, not sleepy, not tired.
So 8.
So it's for individual.
Okay,
what I'm going now.
so sleep.
Sleep. We talked about diet.
But what about diet?
Protein.
Like, what? Oh. So it's not just a bad.
No.
People are like out there eating like 150 grams of protein a day. And I'm like, how do you do that?
Yeah.
I do.
Like, you should do that is what you're saying.
Well, for you should have a nutrition consultant and have that, individualized for you. But let's say I want to get 100 grams of protein a day, which is hard.
Yeah.
Which is hard.
Protein.
Yeah, you do protein shakes and chicken.
Salmon, and the protein shakes.
Yeah, I gave up meat for Lent, so I was a strike too.
But protein helps you maintain your muscle, and it helps you feel full.
Okay.
So,
Okay.
All right.
protein, vegetables
Okay. I like
of every
vegetables.
color.
That's a win.
I had a bowl of those.
So vegetables.
It's very early in Lent right now. I don't know when this will post, but
Make sure that it's colorful, a green and a red or a purple in there. Just think color. Okay. And fruit, fruit for dessert. It's that basic. Exercise.
Okay.
God, yeah, I know. I'm sorry. GLP-1s are just, they're not a magic bullet.
Not actually, when you, stress, sleep, fruits and vegetables, and protein. I mean, those are commonalities in like any diet.
Any healthy lifestyle.
So like, that's not shocking.
right. So when you have a well-rounded, healthy lifestyle,
And you sleep the way your body needs to.
naturally produce at a higher level, which of course makes you lose weight.
Yeah. That makes sense.
Or at least maintain a healthy weight.
Helps you, when you exercise, you just naturally feel more refreshed and your appetite.
I hate that is
For me, I feel like eating something healthy. On the long side.
I will never forget one time going to a workout class with Adama, and you would have thought I was taking her to like a root canal. Like, this is gonna be fun, my friend. Anyway, okay, good tidbit.
You should have seen this class she took me to. Like, it
It was like a torture.
was like a stretching on a rack.
Last thing on that I wanted to say on stress. Remember, there's a gut-brain relationship, and it is
Talk more about this.
legit.
Yes.
So legit. So many people say your gut is your second brain. So you know how sometimes you feel so uncomfortable. That's your body telling you no.
Yeah.
And so that's your gut because you're not listening to your brain. Maybe.
Yeah. Interesting. Well, it's not like intuition is like a second check, like your body being like,
So sometimes we call, I have this feeling. This doesn't feel right here. And it may not feel, it might
not
be
in your
confusing
stomach.
here, but it doesn't feel right here. That's your second brain giving you signals.
Do GLP-1s help with, so a lot of people have like chronic like IBD or IBS. Do they help with that too?
So I'm really careful. If I have a patient that has IBS, I am very, very careful. I have not had to start it on someone like that. I usually connect with their GI specialist because GLP-1s can cause IBS. They can cause nausea, vomiting, diarrhea, acid reflux.
Because I know, we have all of these Hollywood people, and now you have all these memes that are like the before and after of the accused for taking Ozempic because they all have Ozempic face.
I knew this would come up.
Or they're all of a sudden like skinnier than they
They're like
for 10 years
ever.
But they're like,
Right.
yeah. So like, what's the Ozempic thing?
Yeah.
And like, how do you keep your patients from having Ozempic face, or is it like just mainlining protein shakes? Like, what's happening?
mainly. So Ozempic phase happens because you lose your fat. It's rapid weight loss will give you more of an Ozempic phase. I mean, you could still get it if you lose weight slowly and you were very overweight. But if you're not severely overweight, you lose weight fast, then you're going to lose your muscle first, and then you're going to lose your fat. Both.
Oh, okay.
It's both. So it's muscle loss and then laxicity. Is that the word? Skin
laxicity.
And you're less, remember, imagine losing all your plumpness.
Yeah.
Your skin is just going to sag.
Well, and I think a lot of these people are also at times removing buccal fat too. Like they're doing
Buccal fat?
Yeah, like because people are doing. This is the one thing I feel like.
I mean, Botox, people are doing acid or muscle.
Okay, I'm not against that. I have like a lot of mass.
Oh, unless you have TMJ.
I do. Like, I kind of want to get it done. I've been acting all around about it. I called her and I was like, I want to get the masseter talks because I'm like grinding
the teeth.
Yeah. Do you have an indication for it? People are doing it just to have like skinnier jaws.
Oh. I mean, I'm fine.
I feel like that's also a whole other episode.
Yes. Why is everybody so obsessed with treating our face?
I know.
Yeah.
Exactly.
Yeah, we need to talk about that at some point. Anyway. Okay. Well, I know we're almost at time. So what is, a takeaway or something you would want to leave our audience with? Like, what are some tidbits that you'd like to empower our listeners with?
When I prescribe GLP-1, I actually have my patients do a nutrition consult so that they know about how to keep a healthy nutrition, regimen while they're on the GLP-1. Because if you're not hungry and the only thing you're eating is French fries, you are not, your body's not going to be well. You're not going to do
Sounds
well.
logical.
Fair.
So I also tell them to exercise. I say that you're not doing this you're not just doing the injection. You're doing these two things along.
It's the injection and.
Well, both of those will help them develop natural GLP-1s.
Yeah, exactly. So I always say lifestyle. Try lifestyle first if you want to lose weight, which is your natural. Good sleep.
Yeah.
Eat well. Stay hydrated. Reduce your stress levels. And the second takeaway would be, be more open to these drugs. They're very good drugs. They are helping a lot of people that truly need them. Yeah. And there's a lot more research currently being done to make them better, to make them more potent without less side effects and without the muscle wasting side effect. So there's health in them. Yeah.
Right.
Yeah. Stay tuned.
Right.
Yeah. I'm excited to see too.
Thanks for keeping it real.
Yeah.
Everybody know. We're gonna come up with our list of other medical things.
Yeah. Find out. Maybe
Fun.
IBD. Yes.
Yeah. It would also be great to talk about sleep because I do feel like
Sleep. Sometimes it's a battle, but
or like always. We'll dig into that on a future episode. Thanks for being here.
thank you so much,
Nancy. And on our next episode, we will have a friend of Adama's named Marjan Fulhauer, who is in the political sphere, ran for office, and has some learnings about her race. So stay tuned.
Yeah.
All right.
See you next time.